Sometimes the most ordinary moments reveal the most extraordinary stories. In sterile examination rooms across America, doctors ask the same routine question thousands of times each day. What brings you in? They expect simple answers about checkups, minor ailments, or preventive care. But what happens when that innocent question unlocks a story that defies belief? Admiral Rebecca Raven Morrison thought she was just getting her annual physical. The Navy's most decorated female SEAL commander had faced down terrorists, survived impossible missions, and broken barriers that many said could never be broken. Yet sitting on that examination table in civilian clothes, she felt more vulnerable than she had in any combat zone. Dr. Sarah Chun had seen thousands of patients in her 15-year career. She prided herself on maintaining professional composure, no matter what walked through her door. But nothing in medical school had prepared her for the moment she would discover scars that told a story so incredible, so harrowing, and so inspiring that it would change both their lives forever. This is the true story of an ordinary health screening that became anything but ordinary. It's about the moment when a simple medical examination revealed the extraordinary sacrifice, courage, and resilience hidden beneath the surface of someone who looked just like any other patient. It's about what happens when the question, "What brings you in?" opens a door to a world most people never knew existed. Some stories are worth telling not because they're comfortable, but because they're true. This is one of those stories. Dr. Sarah Chun glanced at her watch as she finished reviewing the morning's patient files. 11:30 sharp meant her next appointment would arrive any minute. Rebecca Morrison, age 38, scheduled for an annual physical. The file was remarkably thin for someone her age, containing only basic insurance information and emergency contact details. No previous medical history, no medications, no allergies listed. Either this woman was exceptionally healthy or exceptionally private. Sarah had learned to read between the lines during her 15 years practicing internal medicine at San Diego Medical Center. The lack of medical history often meant one of two things. Either the patient was new to the area or they had received medical care elsewhere, often through military or government channels. The San Diego location made the latter more likely. A soft knock interrupted her thoughts. "Dr. Chun, your 11:30 is here," called Maria, her medical assistant. "Send her in, please." The woman who walked through the door moved with a precision that immediately caught Sarah's attention. Rebecca Morrison was of average height, perhaps 5'6", with shoulder-length brown hair pulled back in a simple ponytail. She wore dark jeans and a navy blue sweater that looked expensive but understated. Her handshake was firm, her eye contact direct, and her smile genuine but measured. "Ms. Morrison, please have a seat. I'm Dr. Chen." "Thank you, doctor. And please call me Rebecca." Sarah settled into her chair and opened the nearly empty file. "I see this is your first visit with us. Are you new to San Diego?" "Recently transferred here for work." Rebecca's answer was polite, but offered no additional details. "And what kind of work brings you to San Diego?" "Government consulting." Another polite, but minimal response. Sarah had encountered this type of patient before. Military personnel, government contractors, people in sensitive positions who had learned that sharing less information was usually safer. She respected that boundary and moved on to more routine questions. "Any current health concerns I should know about?" "None that I'm aware of." "Medications?" "Occasional ibuprofen for minor aches." "Allergies?" "None known." Sarah worked through her standard questionnaire, receiving brief but complete answers to each question. Rebecca answered everything asked but volunteered nothing extra. It was like interviewing someone who had been trained in counterinterrogation techniques. "Family history of any significant medical conditions?" For the first time, Rebecca hesitated. "My father died of a heart attack at 52. My mother is still living, generally healthy." "I'm sorry about your father." "Any siblings?" "One brother. Also healthy as far as I know." Sarah made notes in the file, already forming her initial assessment. Rebecca Morrison appeared to be an intelligent, well-educated woman in excellent physical condition who was extremely careful about personal information. The government consulting explanation made sense, but something in Rebecca's bearing suggested more than typical bureaucratic work. "All right, let's move to the examination room and get your vitals. Rebecca followed Sarah down the hallway to examination room 3. Maria had already prepared the room and left a hospital gown on the examination table. Please change into the gown, opening in the back. I'll be back in a few minutes to begin the examination. Sarah stepped out and returned to her office to review Rebecca's insurance information more carefully. The coverage was excellent, the kind typically provided to federal employees in sensitive positions. The emergency contact was listed as Command Authority with a phone number that had a Virginia area code. No personal contacts, no family members, no friends. That was unusual and telling. When Sarah returned to the examination room, 5 minutes later, Rebecca was seated on the examination table, properly gowned, looking composed and patient. Her civilian clothes were neatly folded on the chair. Let's start with your blood pressure. Sarah wrapped the cuff around Rebecca's arm and began the measurement. The reading was perfect, 110/70. Pulse rate was 58 beats per minute, the kind of resting heart rate typically seen in serious athletes. You're in excellent cardiovascular shape. Do you exercise regularly? Yes. What kind of exercise do you enjoy? Running, swimming, weight training, general fitness activities. Sarah noted the response. Most patients elaborated when discussing hobbies or interests they enjoyed. Rebecca's answers remained factual and minimal. Let's check your heart and lungs. Sarah placed her stethoscope on Rebecca's chest and immediately noticed something interesting. Rebecca's breathing was remarkably controlled and deep, the kind of respiratory pattern seen in people trained in breath control techniques. Her heartbeat was strong and regular with the slow, powerful rhythm of someone in exceptional physical condition. Deep breath in and out. Again, please. Rebecca's lung capacity was impressive. Sarah moved the stethoscope to several positions on her back and chest, listening carefully. Everything sounded perfect, but she was beginning to form a picture of someone whose physical conditioning went far beyond casual fitness. Your cardiovascular health is exceptional. You mentioned running and swimming. Are you training for any particular events? I like to stay in shape for my work. What kind of government consulting requires such excellent physical conditioning? Rebecca met her eyes steadily. The kind that occasionally takes place in challenging environments. It was the first answer that provided any real insight, and it raised more questions than it answered. Sarah decided to continue with the examination and see what else she might learn. I'm going to examine your abdomen now. Please lie back on the table. Rebecca positioned herself on the examination table with the fluid, efficient movements of someone accustomed to following medical instructions. Sarah began her abdominal examination, checking for any abnormalities or tender areas. Any abdominal pain or digestive issues? No. Sarah's trained hands moved systematically across Rebecca's abdomen, checking organ positions and looking for any signs of problems. Everything felt normal, but she noticed something interesting about Rebecca's core muscle development. These were not the abs of someone who did casual sit-ups. This was the kind of deep, functional core strength developed through serious, sustained training. You have impressive core strength. How long have you been training? Most of my adult life. Were you an athlete in college? You could say that. Sarah was beginning to recognize a pattern in Rebecca's responses. She answered every question truthfully, but provided only the minimum information necessary. It was almost as if she had been trained to handle interviews this way. I'm going to examine your arms and shoulders now. Sarah began checking Rebecca's arm strength and range of motion. Again, everything was perfect, but the muscle development told a story of someone who had engaged in serious physical training for years. These are not the arms of someone who did casual workouts. The muscle definition spoke of functional strength developed through demanding practical application. Excellent muscle tone and flexibility. Do you work with a personal trainer? I've had good training partners over the years. Sarah was starting to piece together a picture, though she wasn't quite sure what she was looking at. Rebecca Morrison was clearly someone involved in work that required exceptional physical conditioning. The careful way she answered questions suggested training in information security. The government consulting explanation was probably true, but incomplete. Let's check your legs and feet now. Sarah began examining Rebecca's lower extremities, checking muscle strength, joint function, and circulation. Again, she found evidence of serious athletic conditioning. Rebecca's legs showed the kind of development seen in serious runners and swimmers, but also something else. There was a functional, practical strength that suggested training beyond athletics. Have you ever had any injuries to your legs or feet? For the second time in the examination, Rebecca hesitated briefly before answering. A few minor injuries over the years. Nothing serious. It was the first answer that felt less than completely honest. Sarah made a mental note, but continued her examination. She was checking Rebecca's feet when she noticed something that made her look more carefully. There was a small, faint scar on the bottom of Rebecca's left foot. It was old, well-healed, and would have been easy to miss, but Sarah's trained eye caught it. The scar was consistent with a penetrating wound, possibly from stepping on something sharp. This scar on your foot, how did that happen? Stepped on something sharp while hiking. The answer came quickly, perhaps too quickly. Sarah examined the scar more closely. It was definitely old, probably several years healed, and the location and appearance were consistent with the hiking explanation. But something about Rebecca's immediate response made her wonder if there was more to the story. Looks like it healed well. Did you need stitches? Field treatment was sufficient. Field treatment. That was an interesting choice of words. Most people would say they cleaned it up themselves or went to a clinic. Field treatment suggested someone trained in emergency medical care or someone who had been in a situation where professional medical care wasn't immediately available. Sarah finished examining Rebecca's feet and moved on to checking her hands and arms more thoroughly. She was looking at Rebecca's hands when she noticed another small scar, this one on her palm. It was also old and well-healed, barely visible unless you were looking for it. Another hiking injury? Sarah asked, indicating the palm scar. Something like that. This time Rebecca's answer was even more evasive, and Sarah began to suspect she was looking at more than recreational hiking injuries. She continued her examination, now paying closer attention to any other marks or scars she might have missed. That's when she found them. On Rebecca's back, barely visible unless the light hit them just right, were 3 small scars in a pattern that made Sarah's breath catch in her throat. They were old, expertly treated, and positioned in a way that suggested they had not been caused by any accident. These were scars that told a story Sarah was not prepared for. The scars were small, round, and positioned in a triangular pattern on Rebecca's left shoulder blade. Each was no more than a centimeter across, but their appearance and positioning were unmistakable to someone with medical training. These were entry wounds from high-velocity projectiles. Bullet wounds. Sarah stared at the scars for several seconds, her medical training warring with her growing realization of what she was seeing. She had treated gunshot wounds before, but usually fresh ones in emergency situations. These were old, healed wounds that someone had survived and lived with for years. "Rebecca," Sarah said quietly, "I need to ask you about these scars on your back." She could see Rebecca's shoulders tense slightly, the first sign of real emotion she had shown during the entire examination. "What about them?" "They appear to be from penetrating trauma. Can you tell me how you received these injuries?" Rebecca was quiet for a long moment. When she spoke, her voice remained steady, but Sarah could hear something new in it. A weight, a seriousness that hadn't been there before. "Dr. Chun, what I'm about to tell you requires your complete discretion. I'm trusting you with information that could put people at risk if it's shared inappropriately." Sarah nodded, her mouth suddenly dry. "Of course. Doctor-patient confidentiality applies to everything you tell me." Rebecca turned to face her, and Sarah saw something in her eyes that she hadn't noticed before. There was a depth there, a hardness that came from seeing things most people never saw, experiencing things most people never experienced. "Those scars are from a mission in Afghanistan 3 years ago. I'm not a government consultant, Dr. Chun. I'm a Navy SEAL. Admiral Rebecca Morrison, United States Navy Special Operations Command." Sarah felt her world shift slightly as Rebecca's words sank in. A Navy SEAL, an admiral. She had heard of women breaking barriers in the military, but she had never met someone who had achieved what Rebecca Morrison had achieved. More importantly, she had never examined someone whose scars told stories of combat most people only saw in movies. "Admiral Morrison," Sarah said, testing the title and feeling the weight of it. I apologize if my questions seemed intrusive. You're doing your job, doctor. And please, Rebecca is fine when we're discussing my medical care. Rebecca's demeanor had shifted slightly. She still maintained her professional composure, but there was less guardedness now that her identity was revealed. I understand you have questions about the scars. I'll answer what I can. Sarah gathered her thoughts, trying to process this new information while maintaining her professional focus. The scars on your back appear to be from gunshot wounds. Are there any ongoing medical issues related to those injuries? No current problems. The wounds were properly treated, and I completed a full rehabilitation program. Full range of motion was restored within 6 months. Sarah made notes in Rebecca's file, her handwriting slightly less steady than usual. Were there any complications during healing? Minor infection in one of the wounds, but it was successfully treated with antibiotics. No long-term effects. Any pain or stiffness? Occasionally, especially when weather changes. Nothing that interferes with function. Sarah continued her examination with new understanding. Every perfect vital sign, every indication of exceptional physical conditioning took on new meaning. This wasn't someone who worked out to stay healthy. This was someone whose life had literally depended on physical fitness and whose body bore the evidence of that reality. Rebecca, I need to ask about other potential injuries. In your line of work, have there been other incidents that might affect your health? Rebecca was quiet for a moment, considering how much to share. There have been other incidents. Most resulted in minor injuries that healed completely. A few were more significant. Can you tell me about the more significant ones? A helicopter crash in Iraq in 2019. I suffered a concussion and some bruised ribs, but nothing requiring long-term treatment. An explosion in Syria in 2020 left me with temporary hearing loss, but my hearing has completely recovered. Sarah was taking notes, but part of her mind was struggling to process what she was hearing. Rebecca was recounting these events with the same calm tone most people use to discuss minor fender benders or workplace accidents. The concussion from the helicopter crash, did you experience any lasting effects? Headaches, memory issues, sleep problems? Headaches lasted about 6 months. No memory problems. Sleep patterns took longer to normalize, but that was more due to operational tempo than medical issues. Operational tempo, the pace of missions. It's difficult to maintain normal sleep patterns when you're deploying constantly. Sarah nodded, though she was beginning to understand that her comprehension of Rebecca's world was extremely limited. How long have you been a SEAL? 15 years. I completed basic underwater demolition school in 2009. You've been doing this for 15 years. Sarah couldn't keep the amazement out of her voice. It's been my life, Rebecca replied simply. Sarah finished her physical examination, finding nothing else that concerned her from a medical standpoint. Rebecca's body was a testament to years of rigorous training and careful maintenance. Despite the scars and the history of injuries, she was in better physical condition than most people half her age. From a medical perspective, you're in excellent health, Sarah said as Rebecca began getting dressed. But I have to ask, given your history and the physical demands of your work, are you planning to continue active duty? Rebecca paused while putting on her sweater. That's actually part of why I'm here today. How so? I'm being considered for a new assignment. It would move me away from direct operational roles and into more strategic planning and training responsibilities. The physical demands would be different, though still significant. How do you feel about that potential change? Rebecca finished dressing and sat back down, her expression thoughtful. Honestly, part of me doesn't know who I am without the adrenaline, without the missions. Being a SEAL has defined my adult life. It was the most personal thing Rebecca had shared, and Sarah could hear the uncertainty in her voice. That's a significant life transition. Have you talked to anyone about these feelings? Military psychologists, yes. It's required as part of the evaluation process. But there's something different about discussing it with a civilian doctor. Someone outside the military structure. Sarah nodded, understanding that she was being trusted with something beyond just medical care. What concerns you most about the transition? Whether I can find the same sense of purpose in a different role. Whether I can contribute as meaningfully without being on the front lines. What drew you to become a SEAL originally? Rebecca smiled slightly, the first truly relaxed expression Sarah had seen from her. I want to serve my country in the most effective way possible. I wanted to be where I could make the biggest difference. And you don't think you can make a big difference in strategic roles? Intellectually, I know that planning and training the next generation of operators is crucial. Emotionally, it feels like stepping back from the fight. Sarah finished entering notes in Rebecca's file and set it aside. Can I ask you something that's not strictly medical? Of course. What's it like being a woman in a field that was traditionally closed to women? Rebecca considered the question carefully. Challenging, rewarding, frustrating, inspiring, often all at the same time. Can you elaborate? When I went through training, I was one of only 3 women in my class. The physical standards were the same, but the scrutiny was intense. Every mistake was magnified. Every success was questioned. I had to be better than good enough. Did you ever consider quitting? Every day for the first 6 months. Rebecca's honesty was stark. But I had incredible mentors who helped me understand that the challenge wasn't just about proving I belonged. It was about opening doors for the women who would come after me. Do you think you succeeded in that? There are more women in special operations now than there were 15 years ago. Not as many as there should be, but progress is being made. Sarah found herself deeply moved by Rebecca's matter-of-fact discussion of what must have been an extraordinarily difficult journey. What advice would you give to young women considering military service? Know why you're doing it. If you're doing it to prove something to other people, that's not enough. You have to be doing it because you believe in the mission and you're willing to sacrifice for it. What have you had to sacrifice? Rebecca was quiet for a long moment. Traditional family life, long-term relationships, a sense of home base, privacy, the luxury of feeling safe in crowds. Do you regret those sacrifices? Not the sacrifices themselves, but sometimes I wonder what kind of person I might have been if I had made different choices. Sarah could hear the weight of years in Rebecca's voice, the accumulated cost of a life lived in service to something larger than herself. Rebecca, I hope you don't mind me saying this, but you've accomplished something extraordinary. You've broken barriers and served your country with incredible distinction. Thank you, Dr. Chun. Though I have to say, sitting in this examination room, I feel like just another patient with some scars and a decision to make about my future. That's exactly what makes what you've done so remarkable. You are just another person dealing with the same fundamental human questions we all face. But you've chosen to answer those questions in service to something bigger than yourself. Rebecca stood up to leave, extending her hand to Sarah. Thank you for the examination and for listening. It's been helpful to talk through some of these issues with someone outside the military environment. Before you go, I want to ask about follow-up care. Given your history of injuries and the physical demands of your work, I'd recommend some additional screening. What kind of screening? A comprehensive neurological evaluation to establish a baseline for any future head injuries. Some additional imaging of your back to ensure those old wounds haven't created any structural issues we can't detect through physical examination. Is that medically necessary? It's preventive, given your history and the possibility of continued physical demands in your new role. Having detailed baseline data could be important for your long-term health. Rebecca nodded. That makes sense. Can you arrange those tests? I'll have Maria schedule them and call you with the appointments. Dr. Chun, before I leave, I need to ask you something important. Of course. The information I've shared with you today about my identity and my service record, it needs to remain confidential. Not just for my privacy, but for operational security reasons. I understand completely. Everything you've told me falls under doctor-patient privilege. I appreciate that. Most people in my position receive medical care through military facilities where confidentiality is understood. Using civilian medical care requires a different level of trust. Why did you choose civilian care for this examination? I want an outside perspective. Military doctors, even the best ones, view everything through the lens of continued service capability. Sometimes you need someone who's looking at you as a person rather than as an asset. Sarah understood. Well, from both perspectives, medical and personal, I think you're making a wise choice in considering the transition. Your body has given you incredible service, but it's also absorbed significant trauma. Moving to a role with different physical demands could extend your ability to serve effectively. That's what the rational part of my mind tells me. What does the emotional part tell you? That I'm not ready to stop being who I've been for 15 years. Who you've been for 15 years has been remarkable. But maybe it's time to become who you're going to be for the next 15 years. Rebecca paused at the door, considering Sarah's words. Dr. Chun, thank you. This conversation has been more helpful than you might realize. I'm glad. And Rebecca? Yes. Whatever you decide about your future, remember that your value isn't just in what you can do. It's in who you are and what you've learned. That experience and wisdom might be exactly what the next generation of servicemen and women need. Rebecca smiled, a real smile this time. I'll remember that. After Rebecca left, Sarah sat in the examination room for several minutes, processing what had just happened. She had conducted thousands of routine physical examinations in her career, but this one would stay with her. The woman who had walked into her office that morning had seemed like any other patient. The woman who walked out was someone who had served her country in ways most people could never imagine, who carried scars that told stories of courage and sacrifice, and who was facing the same fundamental human challenge of reinventing herself that everyone faced at different points in their lives. Sarah made her final notes in Rebecca's file, but she knew that the real impact of this encounter wouldn't be captured in any medical record. Sometimes the most important healing happened not through treatment, but through simply being heard and understood. 3 weeks later, Sarah was reviewing test results in her office when Maria knocked on her door. Dr. Chun, Admiral Morrison is here for her follow-up appointment to discuss those test results. Send her in, please. Rebecca entered the office wearing civilian clothes again, but Sarah noticed something different about her demeanor. There was less tension in her shoulders, and her smile seemed more natural. Rebecca, please have a seat. How have you been feeling since our last visit? Better than I expected. Actually, I've had time to process our conversation, and it helped clarify some things for me. I'm glad to hear that. I have your test results here, and overall, the news is very good. Sarah opened Rebecca's file and pulled out several reports. Let's start with the neurological evaluation. Dr. Martinez found no evidence of any lasting effects from your previous head injuries. Your cognitive function, memory, and reflexes are all excellent. That's a relief. I was concerned about the concussion from the helicopter crash. The brain has remarkable healing capabilities, especially when the patient maintains excellent physical condition as you have. Dr. Martinez did note that you show some hypervigilance responses that are consistent with your operational background, but those are adaptive behaviors rather than medical concerns. Rebecca nodded. Situational awareness becomes second nature in my line of work. The imaging studies of your back were also reassuring. The old wounds have healed completely with no structural damage to the underlying muscle or bone. There's some minor scar tissue, which is expected, but nothing that should limit your function. Any recommendations based on the results? Continue your current fitness routine, but consider adding more flexibility and mobility work as you age. Your cardiovascular health is exceptional, but maintaining range of motion will be important for long-term function. Sarah set the test results aside and studied Rebecca's expression. How are you feeling about the career decision you mentioned last time? I've accepted the new assignment. How do you feel about that decision? Rebecca leaned back in her chair, looking more relaxed than she had during their first meeting. Nervous but excited. I spent a lot of time thinking about what you said regarding becoming who I'm going to be for the next 15 years. What helped you decide? I had a conversation with my commanding officer about what the new role would actually involve. It's not just administrative work. I'll be developing training protocols, mentoring new operators, and working on strategic planning for future operations. That sounds like it would utilize your experience very effectively. That's what I realized. All the knowledge I've gained, all the lessons I've learned, they don't become irrelevant just because I'm not personally carrying out missions anymore. In some ways, I can have a broader impact by sharing that experience with others. Sarah smiled. That's a healthy perspective on the transition. I also realized something else during these past few weeks. What's that? I've been defining myself so narrowly by what I do that I lost sight of who I am beyond my job. Even elite military operators need to develop identity beyond their service. That's a profound insight. What have you discovered about who you are beyond your military role? Rebecca was quiet for a moment, considering her answer. I'm still figuring that out, honestly, but I know I care deeply about mentoring others. I enjoy problem solving and strategic thinking, and I think I have something valuable to offer in terms of helping other people navigate difficult transitions. Those are meaningful discoveries. Dr. Chun, can I ask you something personal? Of course. How do you maintain perspective in your work? You see people dealing with health crises, life-changing diagnoses, traumatic injuries. How do you process all of that without losing your sense of hope or optimism? Sarah considered the question carefully. It's challenging sometimes, but I've learned that bearing witness to someone's struggle is a privilege. When people trust you with their pain, their fears, their vulnerability, that's sacred ground. How do you mean? Every person who walks through that door has a story. Most of those stories include struggle, loss, fear, uncertainty. But they also include resilience, courage, hope, and the fundamental human capacity to endure and overcome. Rebecca nodded slowly. I think I understand. In my work, I focus on the mission, on the outcome, on protecting people. But maybe I missed some of the individual stories along the way. Your work protected people's ability to live their stories freely. That's not insignificant, but maybe in my new role, I can pay more attention to the individual people I'm working with, not just the operational objectives. That sounds like wisdom gained through experience. Rebecca stood up, preparing to leave. Dr. Chun, I want to thank you again. This process has been more valuable than I anticipated. I'm glad it's been helpful. Will you stay in the San Diego area for your new assignment? Yes, I'll be based at Coronado for the foreseeable future. Good. I'd like to see you annually for follow-up care, and I want you to feel comfortable calling if you have any concerns as you adjust to your new role. I appreciate that. Actually, I have one more question. What's that? You mentioned during our first meeting that you've been practicing medicine for 15 years. Have you ever considered transitions in your own career? Sarah was surprised by the question, but found herself wanting to answer honestly. Actually, yes. I've been thinking about expanding my practice to include more preventive care and wellness counseling. What's holding you back? Fear, mostly. Fear of changing something that's working well. Fear of not being as successful in a new area. Rebecca smiled. That sounds familiar. What would you tell a patient who expressed those concerns? Sarah laughed. I'd probably tell them that growth often requires stepping outside their comfort zone, and that their skills and experience would transfer to new challenges. Good advice, doctor. It's easier to give advice than to take it. In my experience, the best leaders are the ones who continue to challenge themselves to grow. Maybe it's time for both of us to practice what we preach. Sarah found herself genuinely moved by the conversation. You know, Rebecca, when you first walked into my office, I thought I was just conducting a routine physical examination. And now I realize I was meeting someone who would challenge me to think differently about courage, service, and personal growth. Rebecca extended her hand. The feeling is mutual, Dr. Chun. Thank you for seeing me as a person first and a patient second. That's what medicine should be about. I hope you'll consider expanding your practice. I think you'd have a lot to offer in terms of helping people navigate major life transitions. After Rebecca left, Sarah sat in her office thinking about their conversation. She had entered medicine to help people, but she was beginning to realize that helping people involved more than just diagnosing and treating medical conditions. It involved seeing the whole person, understanding their story, and sometimes helping them see themselves more clearly. She picked up her phone and dialed the number for Dr. Martinez, the neurologist who had evaluated Rebecca. Dr. Martinez, this is Sarah Chun. I wanted to thank you for the thorough evaluation you did on my patient, Admiral Morrison. Admiral Morrison? I evaluated a Rebecca Morrison, but I wasn't aware she was military. She's a Navy SEAL. The evaluation was part of a career transition process. That explains the exceptional physical conditioning and the hypervigilance responses I noted. What's her transition? Moving from operational roles to strategic planning and training positions. That's probably wise. Her neurological function is excellent, but she's absorbed significant physical trauma over the years. The cumulative effects of repeated head impacts, even minor ones, can be problematic long-term. Did you discuss that with her? I mentioned it briefly, but she seemed focused on ensuring she was fit for continued service rather than concerned about long-term effects. That's consistent with her personality. She's very mission-focused. Dr. Chun, can I ask why you're calling about this particular patient? Sarah paused, trying to articulate what she was feeling. She's made me think about the broader impact we can have as physicians, not just in treating medical conditions, but in helping people understand themselves and navigate major life changes. That's an interesting perspective. Are you thinking about expanding your practice focus? I'm considering it. You should. You have good instincts for that kind of work. Let me know if you want to discuss it further. After hanging up, Sarah made a note in her calendar to research wellness and transition counseling programs. Rebecca's influence was already changing how she thought about her own career path. 2 days later, Sarah received a package at her office with no return address. Inside was a book titled Warrior to Civilian, Navigating Life Transitions, and a handwritten note. Dr. Chun, I thought you might find this interesting as you consider expanding your practice. The author is a former special operations psychologist who specializes in helping military personnel transition to civilian careers. Some of the concepts might apply to anyone facing major life changes. Thank you again for your care and guidance. R. Morrison. Sarah opened the book and found an inscription on the title page for Dr. Sarah Chun, a healer who understands that medicine is about more than medical care. With gratitude, Admiral Rebecca Morrison. She spent her lunch break reading the first chapter, which discussed the psychological challenges faced by people transitioning from high-intensity careers. The parallels to civilian career changes were immediately apparent, and Sarah found herself taking notes about how these concepts might apply to her own patients. That afternoon, she had a follow-up appointment with a patient who was struggling with anxiety related to a recent job change. Instead of focusing solely on the anxiety symptoms, Sarah found herself asking different questions about the patient's identity and sense of purpose. The conversation was more meaningful than their previous sessions, and the patient left with a clearer understanding of how to navigate the transition. Over the following weeks, Sarah began incorporating transition counseling concepts into her practice. She was surprised by how many of her patients were dealing with major life changes and how much they appreciated having a medical professional who understood that physical health was connected to emotional and psychological well-being. A month after Rebecca's follow-up visit, Sarah made a decision. She enrolled in a certification program for wellness and transition counseling. It would mean additional training and some restructuring of her practice, but she was excited about the possibility of providing more comprehensive care to her patients. The day she mailed her application for the certification program, she thought about Rebecca Morrison and wondered how she was adjusting to her new role. She hoped that their brief intersection had been as meaningful for Rebecca as it had been for her. Sometimes the most important encounters in medicine happen not in emergency rooms or surgical suites, but in quiet examination rooms where two people connected as human beings dealing with the universal challenges of growth, change, and finding meaning in their work. Sarah looked forward to her next annual appointment with Rebecca, curious to learn how both of their transitions had unfolded. 6 months later, Sarah was finishing her morning rounds when Maria approached with a familiar name on the appointment list. Dr. Chun, Admiral Morrison is here for her follow-up appointment, but she's not alone today. Sarah looked up from her patient files with interest. Not alone. She's with a young woman, maybe early 20s. She asked if you might have a few extra minutes to speak with both of them. Of course. Give me 5 minutes to finish these notes, then send them in. Sarah quickly completed her documentation and straightened her office. She was curious about who Rebecca had brought and what had prompted the visit. When Maria opened the door, Rebecca entered with a young woman who immediately caught Sarah's attention. The young woman was tall, athletic with short blonde hair, and the same kind of precise bearing that Rebecca displayed. But where Rebecca projected confidence and control, this young woman seemed nervous and uncertain. Dr. Chun, thank you for seeing us on short notice, Rebecca said, extending her hand. I'd like you to meet Lieutenant Commander Jessica Torres. She's working with me in my new assignment. Sarah shook hands with both women, and gestured for them to sit. Jessica's handshake was firm but brief, and she avoided direct eye contact. "It's nice to meet you, Jessica. How can I help both of you today?" Rebecca and Jessica exchanged glances, and Sarah could see some kind of silent communication passing between them. "Jessica is dealing with some of the same transition issues we discussed when I was here," Rebecca began. "She's been having difficulty adjusting to changes in her role, and I thought it might be helpful for her to speak with someone outside the military structure." Sarah turned her attention to Jessica, noting the tension in the young woman's posture. "Jessica, what kind of changes are you dealing with?" Jessica looked at Rebecca, who nodded encouragingly. "I was injured 6 months ago during a training exercise," Jessica said quietly. "The injury has healed, but it's affected my ability to meet certain physical standards required for my previous position." "What kind of injury?" "Spinal compression fracture. Non-surgical, but it's left me with some limitations in terms of heavy lifting and high-impact activities." Sarah could hear the pain in Jessica's voice that went beyond physical discomfort. "That must be frustrating for someone in your line of work." "It is. I've been in special operations for 8 years. It's all I know how to do." Rebecca leaned forward slightly. "Jessica is one of the most tactically sound operators I've worked with. Her injury doesn't diminish her capabilities, but the medical restrictions mean she needs to transition to different kinds of roles." "How are you handling that transition, Jessica?" Jessica's composure cracked slightly, and Sarah could see tears forming in her eyes. "I'm not handling it well. I feel like I'm letting everyone down. Like I'm broken." The raw emotion in Jessica's voice was heartbreaking, and Sarah understood why Rebecca had brought her here. This wasn't just about medical care. It was about helping someone rebuild their sense of identity and worth. "Jessica, can you tell me about the injury? How did it happen?" "Fast rope training exercise. Equipment malfunction caused a hard landing. The immediate pain wasn't severe, so I finished the exercise. The real damage became apparent over the following days." "You continued training with a spinal injury?" Jessica looked embarrassed. "I thought it was just bruising. In our line of work, you learn to push through pain." Rebecca spoke up. "That's actually part of the problem Jessica is facing. The culture that teaches you to push through everything makes it difficult to accept limitations when they do occur." Sarah nodded, understanding the psychological complexity of the situation. "Jessica, have you received counseling about this transition?" "Military psychologists, yes. But it feels like they're trying to fix me so I can get back to operational status. I don't think they understand that might not be possible." "What do you want from this situation? If you could design the perfect outcome, what would it look like?" Jessica was quiet for a long moment, considering the question. "I want to still matter. I want to contribute something meaningful. I want to feel like my experience and knowledge have value, even if I can't do the physical things I used to do." "Those are completely reasonable wants," Sarah said gently. "Can you tell me about your experience and knowledge? What have you learned in 8 years of special operations?" For the first time since entering the office, Jessica's posture relaxed slightly. "I understand tactics and strategy. I'm good at reading situations and predicting how they'll develop. I understand how teams work together under pressure. Those sound like valuable skills." "They are," Rebecca interjected. "Jessica has an intuitive understanding of team dynamics that took me years to develop. She's also exceptional at training and mentoring newer operators." "Do you enjoy training and mentoring?" Sarah asked Jessica. "I do, actually. I like helping people learn and improve." "What's preventing you from pursuing that direction?" Jessica looked down at her hands. "It feels like settling, like accepting defeat." Sarah leaned forward in her chair. "Jessica, can I share something with you about my own experience?" Jessica nodded. "I've been practicing medicine for 15 years, and 6 months ago, I made a decision to expand my practice to include transition counseling and wellness coaching. For months before making that decision, I felt like I was considering a step backward, like I was abandoning what I was good at." "What changed your mind?" "I realized I was confusing change with failure. I wasn't stepping backward. I was stepping forward into a more comprehensive way to help people. But what if I'm not good at the new role? What if I fail?" Rebecca spoke up. "Jessica, what did you think the first time you attempted a fast rope descent?" "I was terrified I'd mess up and hurt myself or someone else. But you learned, and you became proficient. That was different. I was young, and I knew I had physical ability. You still have ability, Sarah said. It's just different ability now. Jessica, what would you tell a young person who is considering whether to pursue special operations training? Jessica thought for a moment. I'd tell them it's challenging, but rewarding. That they'd learn things about themselves they never knew. That they'd have the opportunity to serve something bigger than themselves. All of those things are still true in training and mentoring roles. You're still serving something bigger than yourself. You're still learning things about yourself. The challenge is different, but it's still meaningful. Jessica wiped her eyes with the back of her hand. I know you're right intellectually, but emotionally, it feels like I'm giving up. What you're feeling is completely normal, Sarah assured her. Grief for the life and identity you're leaving behind is part of any major transition, even positive ones. How do you work through that grief? You allow yourself to feel it, but you don't let it define your future. You honor what you're leaving behind while remaining open to what you're moving toward. Rebecca reached over and touched Jessica's arm. Jessica, when I was considering my own transition 6 months ago, I struggled with many of the same feelings you're experiencing. Really, I was defining myself so narrowly by what I could do physically that I lost sight of all the other ways I could contribute. What helped you adjust? Time, perspective, and conversations like this one. But mostly, I had to start doing the new work and discover that it was fulfilling in ways I hadn't expected. Sarah looked at both women and realized she was witnessing something remarkable. Rebecca had not only successfully navigated her own transition, but was now helping someone else through a similar process. The mentoring and leadership skills she had worried about were already being put to good use. Jessica, have you had any opportunities to try training or mentoring work yet? Some. I've been working with a group of new recruits on tactical planning exercises. How has that gone? For the first time since entering the office, Jessica smiled slightly. Better than I expected. I enjoyed it more than I thought I would. What did you enjoy about it? Watching them understand concepts that took me years to learn. Helping them avoid mistakes I made early in my career. Seeing them develop confidence. Rebecca smiled. That's exactly the kind of work we need more people doing. Jessica has a gift for breaking down complex concepts and making them understandable. It sounds like you've already begun your transition, Sarah observed. You just haven't recognized it yet. What do you mean? You're already contributing meaningfully in your new capacity. You're already using your experience and knowledge to help others. You're already serving something bigger than yourself. Jessica was quiet for several minutes, processing what she had heard. I think I've been so focused on what I can't do anymore that I haven't paid attention to what I can do. That's a very human response, Sarah said. We tend to focus on our losses rather than our gains. Dr. Chun, Rebecca said, Jessica is considering whether to stay in the Navy or transition to civilian life. Do you have any thoughts about how to make that decision? Sarah considered the question carefully. That's ultimately Jessica's decision, but I think the key is to focus on where you can have the most impact doing work that fulfills you, rather than focusing on which option feels safer or more familiar. How do I figure out where I can have the most impact? By trying different things and paying attention to what energizes you versus what drains you. By asking yourself where your unique combination of skills and experience will be most valuable. Jessica turned to Rebecca. How did you decide to stay in the Navy? I realized that my knowledge and experience would be most valuable within the military structure, working with people who understand the context and challenges of special operations. But that doesn't mean it's the right choice for everyone. What would civilian opportunities look like for someone with my background? Sarah thought for a moment. There are consulting firms that work with corporations on team building and leadership development. There are educational institutions that need people who understand high-performance training. There are government contractors who need people with your operational background. Those sound interesting, but also unfamiliar. Everything is unfamiliar until you try it, Rebecca pointed out. When I first considered special operations training, it was completely unfamiliar. That didn't stop me from pursuing it. That's true. Sarah looked at both women and felt a profound sense of respect for what they were dealing with. I want to say something to both of you. The conversation we're having today represents exactly the kind of leadership and mentorship that organizations need more of. Rebecca, you're using your experience to help someone else navigate a difficult transition. Jessica, you're being vulnerable enough to ask for help and honest enough to examine your own assumptions. Thank you, Jessica said quietly. I'd like to suggest something, Sarah continued. Jessica, what if you gave yourself a timeline to experiment with different roles before making a final decision about your future? What kind of timeline? 6 months, maybe a year. Try different types of training and mentoring work. Shadow people in civilian roles that interest you. Pay attention to what feels meaningful and what doesn't. Rebecca nodded approvingly. That's good advice. There's no rush to make permanent decisions while you're still adjusting to the initial change. And Jessica, Sarah added, I want you to remember that identity is not just about what you do. It's about who you are, what you value, and how you choose to contribute to the world. I'll try to remember that. Rebecca, how are you feeling about your own transition at this point? Better, every day. The work is challenging and meaningful. I'm learning new skills while using experience I've gained over the years. And opportunities like this to help someone else through a similar process make it clear that I'm exactly where I need to be. Sarah smiled. It sounds like both of you are exactly where you need to be right now, even if you're not sure where you'll be in the future. As the appointment concluded, Sarah felt a deep sense of satisfaction. Medicine, she had learned, was not just about treating illness or injury. Sometimes it was about helping people see themselves clearly and find their way through difficult transitions. After Rebecca and Jessica left, Sarah made a note in Jessica's file about scheduling a follow-up appointment in a few months. She also made a personal note to check in with Rebecca about how her mentoring work was developing. The encounter reinforced her decision to expand her practice focus. There were clearly many people dealing with significant life transitions who needed support that went beyond traditional medical care. She was grateful to be developing the skills to provide that kind of comprehensive support. That evening, Sarah reflected on how much her own practice and perspective had changed since meeting Rebecca Morrison. Sometimes the most significant growth happened not through dramatic events, but through quiet conversations that challenge you to see yourself and your work differently. She looked forward to continuing to follow both Rebecca and Jessica's journeys, curious to see how their stories would unfold. 1 year later, Sarah was preparing for her evening transition counseling workshop when Maria knocked on her office door. Dr. Chun, I have Admiral Morrison online too. She says it's not urgent, but she'd like to speak with you when you have a moment. Sarah picked up the phone with a smile. She had been wondering how Rebecca was doing in her new role and was pleased to hear from her. Rebecca, it's good to hear from you. How are things going? Very well, actually. I'm calling with some news I thought you'd find interesting. I am listening. Jessica Torres has decided to stay in the Navy. She's been accepted into a new program we're developing for transitioning special operations personnel into training and strategic roles. That's wonderful news. How is she doing with the transition? Better than either of us expected. She's become one of our most effective instructors, and she's been instrumental in developing new training protocols that incorporate lessons learned from recent operations. Sarah felt a surge of satisfaction. I'm so glad to hear that. She seemed like she had tremendous potential when I met her. She just needed time and support to recognize it herself. Actually, that's part of why I'm calling. How so? The program, Jessica, has been so successful that we're expanding it. We're developing a comprehensive transition support system for military personnel who are dealing with career changes, whether due to injury, changing family circumstances, or just natural career evolution. That sounds like exactly what's needed. We think so. The interesting thing is we're looking for civilian consultants to help design and implement parts of the program. People with medical backgrounds who understand both physical and psychological aspects of major life transitions. Sarah felt her heart rate increase slightly. Are you offering me a consulting opportunity? I am. We need someone who can work with our personnel to develop transition planning protocols, provide counseling support, and train military medical staff in transition-focused care. Rebecca, that sounds fascinating, but I don't have any military background. That's exactly why we need you. We need someone who can bring an outside perspective to how we approach these issues. Your work with Jessica showed us that civilian medical professionals can provide support that military personnel sometimes can't get within our normal structure. Sarah was quiet for a moment, processing the unexpected opportunity. What would the time commitment involve? Initially, a few days per month. Potentially more if the program grows as we expect it will. Can I ask how this opportunity came about? Jessica suggested it. She's been talking to other people going through similar transitions, and many of them have mentioned that they wish they had access to the kind of support you provided her. I'm flattered and definitely interested. Can you tell me more about what the work would involve? Developing intake protocols for people entering the transition program. Training our counseling staff in civilian transition planning techniques. Providing direct counseling support for complex cases. And possibly developing educational materials for families of transitioning personnel. The family component sounds particularly important. It is. We've learned that successful transitions almost always involve family support, but families often don't understand what their loved one is going through or how to help. Sarah thought about her own transition counseling work and how many of her patients struggled with family relationships during major life changes. I'd be very interested in exploring this opportunity. Excellent. I'll have our contracting office send you some information about how the program is structured and what we're looking for. Rebecca, can I ask how you're feeling about your role now, a year later? Honestly, I can't imagine doing anything else. I thought I would miss the adrenaline and the direct action, but what I'm doing now feels more impactful in some ways. How so? In operational roles, I could affect the outcome of specific missions. In this role, I can affect the careers and lives of hundreds of people. Every person we help transition successfully goes on to contribute in new ways, often for decades. That's a beautiful way to think about it. It's also more sustainable. I can do this work for the rest of my career without worrying about physical limitations or age restrictions. And how is your health? Any issues with the old injuries? No problems at all. I've actually been sleeping better than I have in years. Less stress, more regular schedule, and work that feels deeply meaningful. I'm so glad to hear that. You made a wise decision. Dr. Chen, can I tell you something? Of course. That conversation we had during my first appointment, when you asked me about becoming who I was going to be for the next 15 years instead of holding on to who I had been, that was a turning point for me. I'm honored that it was helpful. It was more than helpful. It changed how I thought about transition from something I was losing to something I was gaining. That's exactly the shift that successful transitions require. Which brings me back to the consulting opportunity. We need someone who understands how to help people make that mental shift. Will you consider it? I'll definitely consider it. Send me the information, and let's schedule a time to discuss it in more detail. I'll do that. And Sarah? Yes. Thank you for everything. You changed the trajectory of my career and probably my life. After hanging up, Sarah sat in her office thinking about the unexpected turn her own career was taking. A year ago, she had been a traditional internal medicine physician. Now she was being invited to consult on military transition programs. She thought about the workshop she was about to conduct that evening for civilian patients dealing with major life transitions. The skills and insights she had developed over the past year would apply directly to military personnel facing similar challenges. Her phone buzzed with a text message from an unknown number. Dr. Chun, this is Jessica Torres. Admiral Morrison said she spoke with you about the consulting opportunity. I wanted you to know that the work you do changed my life. I hope you'll consider joining our program. We need someone who understands that transition is about becoming, not just leaving behind. Sarah smiled and forwarded the message to her husband with a note. Remember when I thought my career was settled and predictable? That evening's workshop went particularly well. Sarah was working with a group of 8 people dealing with various transitions. A recently divorced woman starting a new career, a man who had sold his business and was figuring out retirement, a couple dealing with empty nest syndrome, and others facing significant life changes. Tonight, I want to talk about identity and transition, Sarah began. Most of us define ourselves primarily by our roles, our job, our relationships, our responsibilities. But what happens when those roles change? A woman in the front row raised her hand. We feel lost. Exactly. And that feeling of being lost is completely normal. But it's also an opportunity. An opportunity for what? Asked the recently divorced woman. To discover aspects of yourself that may have been overshadowed by your previous roles. To develop new capabilities. To contribute in ways you haven't considered before. Sarah shared the story of Rebecca Morrison, with permission and with identifying details changed. She talked about how someone could transition from one form of service to another, from one type of contribution to another, without losing their essential identity. The key insight, Sarah continued, is that transition is not about abandoning who you are. It's about becoming a fuller version of who you are. After the workshop, several participants approached Sarah with questions and comments. One man, a retired military officer, stayed until everyone else had left. Dr. Chun, I've been struggling with retirement for 2 years. Tonight was the first time I've heard someone explain it in a way that makes sense to me. What resonated with you? The idea that I don't have to choose between honoring my military service and embracing civilian life. I could do both. How might that look for you? I've been thinking about volunteering with veteran organizations, maybe helping other people with their transitions. Tonight made me realize that could be just as meaningful as active duty, just different. That sounds like a wonderful way to use your experience. Dr. Chun, do you work with military personnel often? Sarah smiled, thinking about the opportunity Rebecca had presented. I'm just beginning to. The following week, Sarah received a comprehensive packet of information about the military transition program. The scope was ambitious, a systematic approach to helping service members navigate career changes while maintaining their sense of purpose and identity. She spent the weekend reviewing the materials and found herself increasingly excited about the opportunity. The work would allow her to apply everything she had learned about transition counseling while learning about military culture and service member needs. On Monday morning, she called Rebecca to schedule a meeting. I reviewed the information, and I'm very interested in the consulting opportunity. That's excellent news. When would you like to meet to discuss details? As soon as possible. I have some ideas about how civilian transition counseling techniques could be adapted for military personnel. I'd love to hear your ideas. How about this afternoon? That afternoon, Sarah found herself in a conference room at Naval Amphibious Base Coronado, surrounded by military officers and civilian contractors discussing transition program development. It was unlike any professional meeting she had ever attended, but the core issues were familiar. How to help people navigate change while maintaining their sense of worth and purpose. Dr. Chun, Rebecca said, introducing her to the group, has pioneered some innovative approaches to transition counseling in civilian medical practice. We think her expertise could significantly enhance our program. Sarah presented her ideas about incorporating transition counseling into military personnel support, adapting techniques she had developed for civilian patients. The response was enthusiastic, and by the end of the meeting, she had agreed to a 6-month consulting contract with the option to extend. Driving home from the base, Sarah reflected on how dramatically her career had changed since that first appointment with Rebecca Morrison. She had been practicing medicine for 15 years when Rebecca walked in her office, but in many ways, her real medical education had just begun that day. She had learned that healing involved more than treating physical symptoms. It involved helping people understand themselves, navigate change, and find meaning in new circumstances. It involved recognizing that every patient had a story and that sometimes the most important thing a doctor could do was listen to that story with respect and understanding. 3 months into her consulting work with a military transition program, Sarah was asked to present her findings at a national conference on veteran affairs. Standing at the podium, looking out at an audience of medical professionals, military officers, and transition specialists, she thought about the journey that had brought her to this moment. 18 months ago, she began, I thought I understood what it meant to practice medicine. I thought my role was to diagnose problems and provide treatment. But I learned from a remarkable patient that medicine is actually about helping people understand themselves and navigate the challenges of being human. She told the story of how her encounter with Admiral Morrison had changed her approach to patient care and led to her current work with military transitions. She talked about the importance of seeing patients as whole people with complex stories rather than just collections of symptoms. The lesson I learned, she concluded, is that healing happens not just through medical intervention, but through human connection, understanding, and support. When we help people see themselves clearly and navigate change successfully, we're practicing medicine at its highest level. The presentation was well received, and afterward, several conference attendees approached Sarah about collaborating on research projects related to transition counseling and veteran care. That evening, Sarah called Rebecca to tell her about the conference. It sounds like it went very well. Better than I expected. Rebecca, I wanted to thank you again for bringing this opportunity to my attention. Thank you for pursuing it. The feedback we're getting about your work with the program has been exceptional. I have to tell you, this work has been more fulfilling than anything I've done in my medical career. Why do you think that is? Because it combines everything I love about medicine, helping people, using clinical skills, conducting research, with a deeper understanding of what it means to serve others. That's exactly what I hoped would happen. Rebecca, can I ask how Jessica is doing? She's thriving. She's been promoted and is now helping to design training programs for other branches of the military. She's also considering pursuing an advanced degree in organizational psychology. That's wonderful. I hope she knows how much her willingness to seek help and embrace change has contributed to this program. She does, and she knows how much your support meant during her transition. We all helped each other through changes we needed to make. That's the best outcome possible. As Sarah hung up the phone, she looked around her office and thought about how much her life had changed since that first appointment with Rebecca Morrison. She was still practicing internal medicine, but now she was also a transition counselor, a military consultant, and a researcher. She was contributing to work that helped people navigate some of the most challenging periods of their lives. Most importantly, she had learned that the question, "What brings you in?" was not just about immediate medical concerns. It was an invitation to understand someone's story, to recognize their struggles and strengths, and to help them see possibilities they might not have recognized on their own. Sometimes the most ordinary moments, a routine physical examination, a simple question, a willingness to listen, could change everything. Sarah was grateful to have learned that lesson and to have the opportunity to apply it in her work with both civilian and military patients facing the universal human challenge of growth, change, and transition. The story that began with Admiral Morrison's scars had evolved into something none of them could have predicted, a new approach to medical care that recognized the fundamental connection between physical health, emotional well-being, and the human capacity for resilience and growth. And it had all started with a simple question: what brings you in?